Good morning, students. Today I am going to show you the structures of the abdominal cavity, including some important structures on the posterior abdominal wall. Let us see what are the organs and what are the important structures are visible. Then I will go to show you the posterior abdominal wall structures. Let us see the partition between the thoracic cavity and abdominal cavity. In between the thoracic cavity and abdominal cavity, the partition is the diaphragm. Can you see the diaphragm? Yes, this is the diaphragm. It is a musculofibrous partition, and below that all the structures are abdominal structures. And the larger structure you can see, this is the liver, and this is the falciform ligament which is dividing the liver into left and right anatomical lobes. And on the inferior surface of the liver, this is the inferior surface or visceral surface. Here you can see the important structure is the gallbladder. Here this is gallbladder, a green color. It is having three parts: fundus, which is beyond the inferior border of the liver, then body and neck. It is inside the fossa of the gallbladder on the under surface of the liver. Then we can see the stomach. You can see, yes, this is the stomach. Lesser curvature on the right side and larger greater curvature on the left side. And the stomach having the anterior superior surface, we can see the anterior superior surface, this one, and behind it is the posterior inferior surface, where you can see the structures on the stomach bed. Of which the important structure you can see the pancreas. Yeah, this is pancreas. It is having four parts. From right to left, if we see the head of the pancreas, which is flat within the C-shaped loop of the duodenum, then its extension to the lower part of the head is the uncinate process. Yes, this is uncinate process, and in front of which you know the structures passing superior mesenteric artery and the superior mesenteric vein. And just next to the head is the neck, and behind the neck the important structure is a formation of portal vein. You can see the portal vein. Can you show? Yes, this is portal vein, and you know it is formed by the splenic vein. This is splenic vein coming from the spleen, and superior mesenteric vein. Yeah, this is superior mesenteric vein, and this is splenic vein, and the trunk of portal vein you can see. Can you show? Yes, this is trunk of portal vein. It is forming behind the neck of the pancreas. Next to neck is the body of the pancreas. The body of the pancreas, it is one of the organ forming the stomach bed, and left part of the pancreas is the tail of the pancreas, which is coming in relation to the visceral surface of the spleen, forming an impression on the spleen as pancreatic impression of spleen. Here this is spleen, so this is pancreatic impression of spleen. Total length of pancreas is about 15 centimeter from head to tail. And another important structure in the stomach bed is the splenic artery. This is splenic artery, and it is running behind the stomach in a tortuous manner, entering into the hilum of the spleen. It is one of the branch from the celiac trunk. This is spleen, and this is splenic artery. And splenic vein also coming out from the spleen and going to the right side to form the trunk of the portal vein. This is stomach. Then this is the pylorus. Then first part of duodenum. Then second part of duodenum. Then third part of duodenum. Then it is cut and removed. The rest part of the small gut like jejunum and ileum, they are removed. And another part of the intestine is a large gut. We can see this is a large gut. The important features of large gut, you all know the three important features. That is tinea. Can you show the tinea? A longitudinal muscular band on the wall of the large gut. Yes, this is tinea coli. Then sacculation. You can see the hostration, and appendix epiploica, small peritoneal pouch throughout the length of the large gut. It is not extending up to the rectum, but in the ascending colon, transverse colon, descending colon, you can see the appendix epiploica. If we start from the ileocecal junction, can you show the ileocecal junction? Yes, this is the terminal part of the ileum. This one entering into the cecum. So this is the cecum, a dilated part, and from the cecum posteromedial side, this blind tube is the appendix. Yes, this is the appendix. The length is variable and it is having different position, you know, from your theoretical knowledge. Then if we go upwards, you will get the ascending colon. A ascending colon ascending upwards, and then there is a flexor or bending. This is called right colic flexor, and this flexor comes in relation to the under surface of the liver. So in the liver you will get one impression for colic impression for the right colic flexor. Then starts the transverse colon. Here you will get the transverse mesocolon. Transverse mesocolon, it is a peritoneal fold. You will identify the transverse colon by means of this transverse mesocolon. But there is no mesocolon or mesentery in the ascending colon or descending colon. Only you will get in the transverse colon. So this is transverse mesocolon. From the left side, you will get the left colic flexor. It is a junction between the transverse colon and descending colon. And left colic flexor, it comes in relation to the medial surface of the spleen. So now we got the impression for colon, that is colic, then pancreas for the tail, and also stomach and kidney. All are in the medial side or visceral surface of the spleen. And if you go lateral side, this is called diaphragmatic surface. Here you will get the diaphragm. Can I show the diaphragm? Yes, this is the diaphragm. Can I show this? This diaphragm. So this diaphragm, it covers the lateral surface or the diaphragmatic surface of the spleen. Next, if we reflect all these structures, we can see the structures on the posterior abdominal wall. Here you can see the kidney on both sides, right kidney and on the side left kidney. And two important vessels, larger vessels are abdominal aorta and inferior vena cava. Abdominal aorta on the left side, and which is 10 cm in length approximately, and right to it is the inferior vena cava. It is wider than the abdominal aorta. It is about 20 to 22 cm in length. And important branches from the abdominal aorta, we can see the ventral branches, celiac trunk. This is the first ventral branch. Yeah, this is celiac trunk. Can you see the celiac trunk coming out as a ventral branch from the abdominal aorta? And it is having three branches. Largest branch is the splenic artery. It is passing behind the stomach as a part of the stomach bed. Yes, this is the splenic artery. Yeah, passing behind the stomach. Now, can you replace the stomach once again? Then next branch of the celiac trunk is the left gastric artery, the smallest branch of the celiac trunk. And another artery is the hepatic artery. Yes, this is hepatic artery. So splenic, left gastric and hepatic, all three are the branches from the celiac trunk. And the common hepatic artery, it gives off the gastroduodenal artery. Yes, this is gastroduodenal artery passing behind the first part of duodenum. Here it divides into two branches, superior pancreaduodenal to the right side and right gastroepiploic artery towards the left side. And then the hepatic artery divides into two terminal branches, right and left. These terminal branches entering into the liver through the porta hepatis, along with the portal vein and hepatic duct. Then we come to the next part or next artery of the abdominal aorta, that is superior mesenteric artery. Yes, this is the origin of superior mesenteric artery at the level of transpyloric plane. And below that, third ventral branch of abdominal aorta is the inferior mesenteric artery. So we got three ventral branches, celiac trunk, then superior mesenteric, then inferior mesenteric. And among the lateral branches, we can see here the renal artery. Renal artery and the origin of superior mesenteric artery both are at the level of transpyloric plane. And this right branch goes to the right kidney and the left branch goes to the left kidney. As because the abdominal aorta lies on the left side, so left artery is shorter than the right artery. And on the other hand, the renal vein coming from the kidney to the inferior vena cava, left side, this is left renal vein, and on this side is right renal vein. So inferior vena cava is right side of the midline. So right renal vein will be shorter than the left renal vein. And the kidney, you can see the hilum of the kidney. Can you show the hilum? Yeah, this is the hilum of the kidney, where you can see the renal artery, then renal vein and the ureter. This is the ureter. Yes, the ureter is coming downwards and enters into the urinary bladder. Total length of the ureter is about 25 centimeter. And the kidney lies on the posterior abdominal wall, behind which you will get the two ribs on the left side and one rib on the right side. 12 rib on the right and 11 12 rib on the left side. besides this rib, you will get other structures as well. Can you reflect the kidney? Yes. Then you can show the nerves lying on the posterior abdominal wall. Yes, this is the subcostal nerve passing behind the posterior surface of the kidney. Then below it is the iliohypogastric nerve. Then below it is the ilioinguinal nerve. So three nerves you will get on the posterior abdominal wall running behind the kidney, and the muscles there you will get the psoas major muscle. Yes, diagonally placed psoas major. This is psoas major, and over which you will get one important nerve, that is genitofemoral nerve. Yes, this is genitofemoral nerve. Root value L1 or L2. It divides into genital branch and femoral branch in the lower part. And other muscle behind the kidney, this is quadratus lumborum. This is quadratus lumborum, and lateral to it is the transversus abdominis. So you will get the important muscles from medial to lateral, that is psoas major, then quadratus lumborum, then transversus abdominis on the posterior abdominal wall, and all these muscles they are behind the posterior surface of the kidney. Then come to the lower side. Here we can see the uterus. It is the female body, so you can see the uterus here. The uppermost part is the fundus. Then you can see the body also, and in the body the anterior surface is flat, but posteriorly it is convex. Uterus, yes. And at the angle of the uterus you can see the three important structures. One is uterine tube. Yes, one is round ligament of uterus, this one, and below and behind is the ligament of ovary. Can you show the ovary? Yeah, this is ovary. So three structures at the angle of uterus are, once again, this is uterine tube, then below and in front round ligament of uterus, below and behind it is the ligament of ovary. So below the entry of the uterine tube is the body of the uterus, but we cannot see properly the cervix, which is going inside the vagina. So some part we can see, there is supravaginal part, but the intravaginal part we cannot see. And the forceps lies in between the uterus and the urinary bladder in front. So this pouch is called the uterovesical pouch, which is shallow. But behind the uterus, you can see another pouch here between the rectum behind and uterus and cervix in front. Yes, can you show this pouch? Can you introduce your finger? Yes, this finger now it is in the pouch of Douglas or rectouterine pouch of Douglas. It is the most dependent part of female in recumbent position. And broad ligament also you can see attached to the sides of the body of the uterus. This is the peritoneal fold. On each side of the uterus is a broad ligament. You know it is having four parts: mesosalpinx in the upper part, then mesovarium running towards the ovary, then infundibulopelvic ligament towards the lateral side, and the lowermost part is the mesometrium. And what we can see, inferior vena cava, it is formed by the two important veins, one from the right side, that is right common iliac vein, and left common iliac vein. Yeah, this is the left common iliac vein, and this is right common iliac vein, and it is joined at the level of L5 vertebra or fifth lumbar vertebra to form the inferior vena cava, and going upwards, and it enters through the inferior vena cava opening of the diaphragm. Similarly, on the left to the vena cava is the aorta. It is dividing or bifurcating at the level of lumbar fourth vertebra, and it is also passing through the diaphragm, not actually through, it is passing behind the diaphragm, between the thoracic vertebra behind, and median arcuate ligament running between the right crus and left crus of the diaphragm, forming the aortic opening. Through it, the aorta is passing downwards from thorax to abdomen. And other structure we can see, sympathetic trunk. Can you show the sympathetic trunk? Sympathetic chain, it is running on each side of the vertebral column. Yes, this is sympathetic chain. Yes, this is sympathetic chain starting from the base of the skull up to the first piece of coccyx. On each side, you will get the sympathetic chain formed by the nerve and the ganglia. So thank you very much. Next we will see the structures on the posterior thoracic wall in another class.